Hello, my name is Kevin Wieling. I am a graduate student in software engineering specializing in game design at the Fontys University of Applied Sciences.
My name is Julian Tekstra. I'm studying software engineering and game design at Fontys.
The context of our assignment is that we were approached by the Catharina hospital who wanted to have a game to motivate patients who are currently recovering from a planned surgery in the hospital to no longer have sedentary behavior. So no longer going into the hospital and thinking they should be lying in bed at all times. They want them to basically get out of bed and walk around more, and they wanted to make sure that walking around more was encouraged with some sort of gamified element. The assignment that we were given was that the Catharina Hospital wanted to have a mobile game that can be played by patients who are able to walk around independently through the hospital hallways. Research has concluded that sedentary behavior in patients after they have had a surgery can actually harm the recovery process. So making walking around more engaging will actually have major health benefits and allow the hospital to be much quicker in helping those patients get back to their homes.
Our process was very test-based because not just we, but also the hospital itself found that most important. We had different meetings where we brainstormed many different elements we could put on our game, and we created some concepts based on that. We diverged those once again into more elements and then converged into one final concept that we've worked on. We built a prototype for that, and then we just kept on testing and testing and testing with not just patients, but different target groups, students here, teachers here as well.
For me, the biggest challenge was knowing how to test the game properly with patients. I tried to focus a lot on making the game as user-friendly for the patients in the hospital as possible. And there are a lot of guidelines on how to make games accessible, but those guidelines are usually written for a very generalized audience. And what you find often in the hospital is that you deal with such a wide range of cognitive and physical ability of patients.
For me, it was communication. I'm not much of a social butterfly. And especially during client meetings, I've kind of stayed in the background and let my project partner take the lead. What I learned is that the creative process can take a wild turn at any point. We have created a bunch of different concepts, like I said at the beginning, but when we actually visited the hospital to see what the areas we're working with, we found that most of these concepts would not work, and we just had to, well, take the elements that we did have and that we thought would work and create a new concept.
Well, the end result of our project is that we have a word guessing game which patients can play on their mobile phone. This is a game that requires the patients to walk around the hospital hallways to find QR code posters that are posted on the walls of the hallway, or they could also be posted up in their own room depending on how far they can walk.
The impact that this will have is that patients will be motivated to walk around more. By making it more fun, we hope that more people will also start walking more.